Okay, we'll get started. I'd like to welcome everybody to this morning's meeting organised by Keep Our NHS Public and Save Our NHS to discuss getting together against Healthier Together, the plan to make big cuts to our health services across Greater Manchester. We'll play it a little by ear as we go along, but the first thing that we're going to do is have a couple of speakers and then open it up to discussion from the floor. After we've had discussion from the floor, if people feel it would be useful to break down into workshops for local campaigns, one for each of the affected hospitals, then that's what we'll do. We'll play it a little bit by ear. What we want to get out of today is everybody more informed about what's happening and the campaigns against the consequences of Healthier Together having developed a little bit further. But of course, this isn't the only thing that's going on, and the biggest issue in the media about the NHS right now is probably the junior doctors dispute. Zoe Brunswick co-organised a demonstration in Manchester of thousands of junior doctors and medical students over the new contracts, and so Zoe's going to explain that and then we'll move on from there.
Right. Yeah, hi, I'm Zoe, as Hugh said. I'm a medical student at Manchester University, and I'm a member of the BMA and a member of the Socialist Party, and yeah, I helped organise the demo last Tuesday in Manchester, which attracted hundreds of junior doctors, and it was really, really good. So I'm just going to speak briefly about what's been happening with junior doctors and the contract, and then how this kind of ties in more to what's happening to the NHS as a whole. So I don't know if you guys know about the contract, but it's just basically another in a long, long line of scandalous attacks on the NHS. After attacking healthcare workers' pensions and pay a few years ago and continuously privatising as much of the NHS as they can get their hands on, the Tories are now turning on what they call junior doctors. But I'd just like to clarify that junior doctors are not just people like me in their early 20s and people who are 1 or 2 years out of medical school. They can be in their late 30s, early 40s. They could have been working for the NHS for 10 or 15 years, could have families to look after, and they're still facing these awful cuts just the same as the rest of us. So this new contract totally strips doctors of all pay or hours security that they currently have. So one of the main things is social hours are being extended from 7 a.m. till 10 p.m. from Monday to Saturday, when they're originally 7 a.m. to 7 p.m. Monday to Friday. So for many doctors, this can result in like up to a 30 or 40% pay cut, and this especially affects specialities such as A&E, psychiatry and GP, which are already the specialities that struggle to attract trainees anyway. I mean, I don't think you find politicians working at 10 p.m. on a Saturday evening, so I don't know how they can say that these hours are sociable, really. Moreover, the contract takes away the safeguards which control how long junior doctors are allowed can work. So we could be going back to the 90 to 100-hour weeks that they worked in the 70s. And also breaks are being shortened to just 20 minutes for every 6 hours. So obviously this has massive implications both for the health and well-being of doctors and also for patients, because, I mean, if you've got an exhausted junior doctor who's been working, I don't know, 13 days on the trot, getting only a 20-minute break every 6 hours, they're not really going to be as good at diagnosing and treating as a junior doctor who's sort of well-rested, worked a reasonable number of hours. And again, with surgeons performing intricate surgery when they're basically just knackered, it's just really not safe for patients at all. And another point is that this new contract also attacks those who want to take time out of their training. So that could be to start a family, to do research, or if they're ill, because it attacks annual pay progression. So now, in order to progress to the next pay level, doctors will have to pass, expensive, time-consuming and just difficult exams in order to progress up to the next pay grade. And the contract attacks many more things as well, but that's kind of the three main ones that I was just going to say. You can always look up on the internet. I think on the BMA website it goes through explaining all the different points of the new contract. But of course this attack on doctors is not isolated. It's just another step that the Tories are taking in their attempt to dismantle the NHS and another part of their agenda of austerity. Already we've seen attacks on healthcare workers' pay and pensions. We've seen hospitals closing or threatening to close or being downgraded, like all across Greater Manchester, with Wythenshawe, with North Manchester, etc. And also, as you probably know, there's been absolutely vicious attacks on mental health services. Here in Manchester, you can wait months now for a mental health referral. And also, something that I found shocking as a medical student is doctors, GPs, are now being told not to refer their patients on to hospital. in certain cases because hospitals just can't cope anymore. And I think I read an article in our paper the other day where there are, I think, 9 trusts around the country where GPs are actually being paid or incentivised not to send their patients onto hospital, which is just ridiculous. It's awful. So again, this can be seen in sort of Healthy Together, why we're here today. That's obviously downgrading the hospital's closure. It's taking vital services away from people who might already struggle to get to their nearest hospital. It's taking them even further away, making it even more difficult for them to get there. So basically, these issues are all down to the vicious austerity programme implemented by the government. They're attempting to bring the NHS down so they can privatise it in its entirety. But despite all this doom and gloom, we are fighting back. To take this junior doctor contract and the attacks on the NHS as an example, last week, as Hugh mentioned, there was a massive demo in Manchester which me and Emma and some more medical students and a couple of doctors helped organise, and it attracted nearly 1,000 people, I think. I don't know.
Yeah.
There's various...
MEM said more than 1,000.
More than 1,000 people, it was amazing. It really was quite uplifting to see actually so many people together there, angry, and junior doctors as well, who are people in the past who haven't, I don't think, particularly engaged that much in political action, but it was really amazing. And there was a demo in London as well, which attracted thousands of people, and that got national news coverage, and it was really good. So as I said, the atmosphere was great. It was great to see so many people eager to fight back against the vicious Tory cuts. In fact, the NHS employers who organised the meetings that we demonstrated outside of, they were so shocked by the horrible backlash that they got that they actually cancelled the meetings just 6 hours before the London one began, which, although it was kind of irritating, is obviously really, really good because it just shows that they had to change their tactics. They're actually frightened of what we're doing. It's quite amazing, really. And in addition to these protests, another extremely important thing has happened as well, which is the BMA is now balloting its junior doctors for strike action. So again, it's a great step forward. We need to really encourage doctors to vote to strike because it's industrial action and refusal to work that is where the real power to fight against the Tories is. So the BMA said that they'll continue to ballot their members to strike and will not re-enter negotiations with the government unless several specific criteria are met. So we need proper recognition of unsociable hours, no disadvantage for those working unsociable hours compared to the current system, no disadvantage for working less than full time, pay for all work done, and proper hours safeguards. So really none of these demands are unreasonable, are they? In fact, many people are saying that we should actually, or could actually be pushing for a pay rise, but the Tories still are not willing to back down on any of these points. I mean, Jeremy Hunt did send a letter recently to the junior doctor chair of the BMA, sort of trying to put across the fact that he was backing down. But in reality, they were all empty promises. He hasn't made any concessions whatsoever. And the BMA, thankfully, has recognised that and sent back a letter saying, no, this isn't acceptable. We're still balloting our doctors to strike. We won't back down. We will fight. We will win against the Tories. So things are being done. The junior doctor contracts got an incredible backlash on social media. There was a petition for balloting doctors for strike action that gained nearly 90,000 signatures, which is amazing. Many people have joined the BMA, and it's, I think, of utmost importance to get any medical students and doctors you know to join the BMA to strengthen from within. There's also another national protest against the junior doctor contract organised in London for the 17th of October, which is next Saturday. Mm-hmm. So I think the union, I don't know if it's organised in transport, but I think it's subsidising
transport.
So if any of you are free to go down, that should be amazing. I mean, you can't really take Facebook attending numbers as they are, but apparently there's nearly 14 or 15,000 people saying they're going already. So it'll be a really good demo if you can get down to it. And there's also 17th of October, next Saturday in London. I'm not entirely sure where.
There are demonstrations happening in the same week in Bristol and in Newcastle, if those are easier places to get to.
And there's also a solidarity demo in Scotland, which is really good because the contract's not actually affecting junior doctors in Scotland or Wales yet, but they're still showing solidarity with us, which is really, really great. So there's also been campaigns to raise public awareness through Twitter and Facebook. I don't know if any of you have seen the Hunt Effect campaign, which is basically a collection of situations where patients have delayed seeking life-saving care due to the fact that they believe Jeremy Hunt's lie that there isn't a 7-day NHS. So they haven't gone to hospital over the weekend because they honestly thought that doctors don't work then, which is ridiculous. Yeah, it's absolutely crazy. And there's also been a campaign where doctors are logging all the extra hours that they work without being paid. So quite often doctors will work an hour extra too at the end of the day, doing paperwork, catching up, and they've been logging this to show how much work that doctors put into the NHS. So this is an excellent start, but more can be done. In order to keep the NHS from being further destroyed, we need to stop all the privatisation, stop paying off PFI debts, and reverse the pay freeze for all NHS workers. And really, we need trade union involvement in our campaign. Ultimately, what would be really good is if there was coordinated strike action between all healthcare unions, the BMA. That would really get the government to back down. Because, well, trade unions are the most powerful force we have, really. But in addition, there's huge public support for the NHS. We're very proud as a nation of the healthcare system that our government is quite frankly trying to destroy. So I think I'd like to see us go out into the community, see what people want, get them involved in the campaign, tell them what's going on with these hospital closures and with these junior doctor contracts. Because I think people find out that they can't go to Wythenshawe anymore, they have to go right the way over to Stepping Hill. They're going to get angry. And I think equally we need to involve, there's groups already of doctors and surgeons in hospitals. There's an example of one in Wythenshawe, the surgeons whose sort of emergency surgery is getting moved to Stepping Hill. They're really angry and they've started trying to do something about it, but I think we really need to reach out to them and reach out to groups like that in other hospitals, leaflet shift changes, get the medical students there involved as well. And that will be a really amazing campaign. And also this junior doctor contract, it's got so many junior doctors and medical students really angry, really outraged, and also really involved in what's been going on, that I think we can sort of harness that momentum and try and get them to help us with the campaign against Healthier Together, with the campaign against other sort of Tory demands to against anything to do with privatising the NHS, really. So just to sort of reiterate, this sell-up of the NHS by our government is completely unacceptable, as we all know, but we can and we will fight back. We can take our NHS back. We need to work with groups in the community, we need to work with groups in hospitals, we need to work with groups in trade unions, we need to unite together, and then we need to fight back against these cuts, and that is the way that we will win back our NHS. Thank you.